In today's video, I'm going to be explaining what dry needling is, how is it different from acupuncture, when would I apply dry needling versus acupuncture, and I'm going to do a demonstration showing you what dry needling looks like. One common question I receive in the office is, what is the difference between dry needling and acupuncture? Dry needling is a treatment technique that uses acupuncture needles to release trigger points or knots or muscle tightness in a particular area where there's a problem. Whereas with acupuncture, it's more of a whole healing system. So we may be treating the local area where there's a problem, but we will also be treating throughout the body to help balance the body and to get it functioning optimally. So with this technique, what we're going to do is we're going to demonstrate what dry needling looks like in the calf area here. So what the patient feels is a little tap, that's me tapping the needle in. They may not feel anything more than that, but often in the calf area they may feel the muscle do a little twitch, and that's normal if they feel that. They also may feel a little dull, achy sensation where there's a problem. So let's demonstrate what it looks like if we dry needle one spot. Here's a spot in the calf muscle we want to treat, so we're going to feel a little tap. You'll notice I may be moving the needle up and down a little bit, and that's just to release the trigger point and not a little bit more. So that's one. The needles will only be left in a few minutes. There's another twitch response right there. And then they're taken out. Whereas with acupuncture, they'll be left in from anywhere from 15 to 30 minutes, just depending on the condition. One other way we can get that twitch response in the muscle is we can also apply some electric stimulation to the needle. What that's going to do is just make the muscle gently kind of contract as I apply that, and it creates like an artificial twitch in the muscle, and just another way to help relax it. So we're going to do a demonstration here showing you what that's going to look like. And you can see the muscle twitching as we release it. So if an area where we didn't get the twitch response that we wanted, or it wasn't as big of a release as we wanted, we can often apply this to help accelerate that and just to help loosen it up even more. Or if we're dealing with a post-surgical case and the muscle's not firing like we want it to, we can also use the stimulation to help accelerate that process even more. Again, the main difference though between the techniques is this is just a localized treatment for a particular muscular problem. So if we're dealing with a muscular problem, that's going to be typically the treatment technique I'm going to use. If we're dealing with more of a whole system problem, then we're going to use acupuncture to treat that. The only really main similarity is the needle we're using. Everything else besides that is completely different. Very effective treatment technique, and often we'll get results just as little as one treatment, but usually by at the most 4 to 5 treatments, and the patient's problem has resolved. So if you're dealing with any muscular issue and you want to try dry needling, give our office a call at 703-912-7822, or you can schedule online at novachirowellness.com.